Hi, Mark Manning here with Medical Management Services in Columbus, Georgia. I'd like to talk for just a minute about the importance of doing your anesthesia coding from an EHR system, if at all possible. For example, recently we had an emergency trauma case come through and everything was written just as exploratory laparotomy, everywhere you looked. But upon further examination and review, looking over the surgeon's operative report, we actually saw that multiple procedures were performed, including a hepatectomy and control of liver hemorrhage. So the base units value, according to ASA RVG, for that procedure is 13 units. If it had been coded as only an exploratory laparotomy, it would have been worth only 6 or 7 base units, according to ASA RVG and ASA codes. So you got to keep in mind, look for multiple procedures, especially on more complex cases. When multiple procedures are performed, you want to go with the highest base value that was performed. This particular case, it really underscores the importance of that because the patient's insurance was commercial insurance. The contracted rate for the anesthesia group with that particular commercial insurance payer was a percentage of gross bill charges. So what that means is, depending upon your gross anesthesia conversion factor for your gross bill charges on that case, in this particular instance, with the base units alone, anywhere from several $100s to well north of $1,500 could have been left on the table. And that's just the base ASA RVG units, not counting time, emergency, any other modifying factors. So, like I said, this is a true life example that underscores the importance of having access to the facility's EHR, if at all possible. If you do not have access, then certainly you need to train your anesthesia care team to be as detailed as possible on the procedures that were performed and record those on the anesthesia records, any anesthesia related documents, charge billing sheets, what have you. But remember, the anesthesia record itself, that's your record when it comes to the truest form of documentation to support your services. So be as specific as possible. Get access to that EHR if you can. If not, make sure your staff is properly trained to record what they actually did. And if we can assist your group or facility in any way, then please let us know. And thank you and have a great day.